So, I'd like to introduce our next speaker. Her name is Mary Cias. She is a lupus warrior of over 30 years experience living with lupus. She brings over 20 years of experience in event planning and fundraising, as well as small grant writing and publicity for nonprofit organizations. She's had 10 years of office experience in government and small businesses, and she has a talent for generating creative ideas and in organizing products with strong planning tendencies and implementing programs. She enjoys sewing, reading, dancing, and baking. She's a 30-year lupus warrior, like I mentioned. She's a 17-year lupus advocate working with congressional leaders to fund lupus advocacy. She's been appointed to several local boards, and she's also had work with the University of Houston Advisory Board with research scientists. She is part of the congressionally directed medical research program, where she participates in the evaluation of research applications submitted to the research program as a consumer reviewer and member with full voting privileges, along with prominent scientists and at meetings to help determine how $10 million is appropriated by Congress for the fiscal year just this past year, and she'll be spending time involving in that with research and the lupus realm. She's earned herself an honorary title of Dr. Cias by many of these scientists. Without further ado, Mary. So, I'd like to introduce our next speaker. Her name is Mary Cias. She is a lupus warrior of over 30 years experience living with lupus. She brings over 20 years of experience in event planning and fundraising, as well as small grant writing and publicity for nonprofit organizations. She's had 10 years of office experience in government and small businesses, and she has a talent for generating creative ideas and in organizing products with strong planning tendencies and implementing programs. She enjoys sewing, reading, dancing, and baking. She's a 30-year lupus warrior, like I mentioned. She's a 17-year lupus advocate working with congressional leaders to fund lupus advocacy. She's been appointed to several local boards, and she's also had work with the University of Houston Advisory Board with research scientists. She is part of the congressionally directed medical research program, where she participates in the evaluation of research applications submitted to the research program as a consumer reviewer and member with full voting privileges, along with prominent scientists and at meetings to help determine how $10 million is appropriated by Congress for the fiscal year just this past year, and she'll be spending time involving in that with research and the lupus realm. She's earned herself an honorary title of Dr. Cias by many of these scientists. Without further ado, Mary.
Well, some of you know me, and some of you I'm new to you. So I'll start off with the beginning of my journey with lupus. To say that I was in shock the first time I heard that word is indescribable. It was January of '93, 20 years last month that I was officially diagnosed. But when I think back, it started 5 years prior, but it wasn't major. It was just kind of here and there. But at any rate, we'll start with 20 years ago when I was diagnosed. I went from 0 pills, because if I got a headache, I'd write a headache out because I hated pills. As a child, my mother would have to melt medicine in a spoon. I wouldn't swallow a pill. It didn't matter how nasty it was, I just didn't like swallowing pills. So therefore, I go from 0 pills to 30 pills a day for about 5 years before we figured out what was working, what wasn't working. You know, there's only so many side effects you can tolerate. You got this pill taking care of this side effect, this one, you know, where does it end? So you learn to live with some things. And that's what I had to do. It's not that I'm not in pain right now. It's just that I prefer living without extra medicine. So you learn to work with it. So I said that to say this. Going forward, I finally get that regimen going. I ended up on 30 milligrams of steroids for a long time. Felt great, felt like myself, but we know steroids aren't good for us. And you see me now, I'm floating between a 14 and 16, give or take. I went up to a 24. and that was too small. I really was a 26, and I refused to buy 26 clothes. I just, that was the breaking point. I mean, I was about to cry in the store, and my son and we were out for the day. I said, son, mommy got to go back home real quick. I forgot something. I didn't know how to explain to a little child what was happening. So we got home. I closed my door. I looked in the mirror. I can tell you, I did not even see myself. And I have a picture. I have pictures. I'll show you guys what I look like. I'll pass it around. I didn't even see myself anymore. I had just been blinded, literally, because I've been living in depression. I was having a pity party. Woe is me. Because the first day, the PC who told me that I had the lupus and guy is diagnosed with lupus and rheumatoid arthritis at the same time. You know, I don't play. I go all the way to the top. Anyway, so he told me that one was debilitating and one was degenerating. That's all I lived on for the next 5 years, taking those pills and stuff. That's why the steroids were real good. Because when he tried to wean me off, oh no, I felt the pain again. No, we wasn't ready. But when I had to go to a size 26, oh, I was ready. I got in that room, I prayed and I prayed and I cried and I told God, I said, look, I don't know how we're doing it. I got to get back to me. In 7 months, I dropped 98 pounds through prayer, cutting back. I didn't eliminate fried foods because I wasn't ever going to give them up. And I did that, and I wasn't just dancing, but I was Zydeco dancing because the little old ladies here at church swore by it. I hated that music. It was, ugh. I don't know if you're familiar with Zydeco, but if you're not used to it, it's the worst sounding thing in the world. And that's what I thought about it. But I said, you know, I look at these little ladies and they really do lose that weight after Christmas. So I said, let me listen to the elders. Body by Step Rito. So now I finally lost this weight, but in the meantime, I'm having to deal with, you know, missing work. But I've always been blessed with great coworkers throughout the years, and they've worked with me, they've assisted me. I'm sorry, let me go back to the beginning. When this hit me, one of the ladies, she said she woke up one morning and she fell. Well, it was Thanksgiving Eve of 1992. I was taking care of seasoning vegetables and baking all of the desserts and getting it out of the way. It was 5 a.m. when I finally stopped. So I woke up at 9 a.m., felt like my right ankle was broken. I thought, what is going on? As the day progressed, by noon or so, it hopped over to the left knee. About 3 o'clock, it's hopping over to the right hip. I'm like, well, what kind of stuff is this? I mean, by that night, it just traveled all over the place. It never stayed long. It just, while it was there, it felt forever. Didn't understand what was going on. We went to a function. We were outside. It was a bitter cold. I felt normal. We got back in the car. I thawed out. There came the pain. I said, well, I don't understand what's going on. By Christmas, I couldn't even be by myself. I had to have someone with me at all times. I'm like, okay, I've lost control of my body. What is this? So after New Year's, I went to the doctor, and that's when I got the A&E. He ran the A&E. No, before he did that, he said, well, you know, you've gone through a lot, because my mother had just died a year prior to that. And it was kind of hard. You know, you lose a parent, it's hard. You lose your mother, it's worse. And that, it was just a lot. And then to find out I got this illness, I mean, it was a serious pity party going on, and depression and stuff. I mean, I had to end up going to counseling, because what a lot of people won't talk about, and I'm not even sure if doctors know, because people won't tell them everything that goes on. Like you said, you got to be transparent with that doctor. There is a dark side to lupus. That pain, you're not ready for. I've had one son, and childbirth was nothing compared to what this does. Nothing. I have been prepped my whole life for lupus, and it's just you just don't want to live. You just don't. But if you're not strong and trust in Jesus to be there and hold his hand, you're not going to make it through this. There was a young lady that I was asked to talk to, because she wanted to commit suicide, because she had a toddler and she got this illness came upon her. The toddler doesn't understand, you know, children. All they know is play. That's their world as a toddler. And what's wrong, mommy? Why you can't play? The toddler mad, screaming, mad at her all day, and she's in this pain. And so I talked to her. I told her everything that I'd gone through, the thoughts I had, the feelings, the whole 9 yards. It was rough. It was really rough. Told her the medicines I was on. It was the longest 4 months of my life before she contacted me to let me know that she thanked me, that I was the only one. There were about 5 or 6 of us that called, but everybody else was talking to her in cliches. You'll be okay. It'll be this. It'll be that. She said they didn't understand what she was going through, but she knew I did because some of what I went through is what she was going through. And she talked to her doctor about my meds, and they switched her on some of mine. Now she can play. I haven't heard from her since. I just pray that everything's well still with her. So let's get back to me. Um, I've had these days. I guess the first time that I couldn't get out of the bed, it just shocked me. I'm like, oh, I'm in the camp. It just, you can't even imagine. You awaken and all you can open are your eyes. You can't move. You can't get out the bed. You can be there an hour. You can be there 2 hours. So I just learned to keep my mobile phone. I didn't used to keep it in the room, but I have to now because I never know when I wake up and tell my boss, well, it might be an hour, it might be half day, it might be a whole day. I won't know until I get there or not. Sometimes I just need a few extra hours sleep, but you don't know. And sometimes I can be in that bed 24 hours. I need to get up. I need to eat. I don't have the strength. So then I have to call my son on the phone, bring me my little stuff. I have a TV tray that I keep. I don't like food in my bedrooms, but lupus has made me have to change my mind. Because I can't get out the bed. I can't go anywhere. And I mean, when I get really, really bad like that, I had a really bad episode Thanksgiving last year, year before last. My son's grandmother still has her registered nurse license, so I have her to come over when I really need a little extra help before I have to go to the doctor. And she looks out for me and helps me out. And she had me to start wearing Depends. I felt so old. But I had no choice. I wasn't able to get out of the bed whenever I feel that sensation. And I was just like, oh gosh. I said, I finally reached another realm. But with this lupus and stuff, it's tough. I have days that my fingers will lock on me and I can't write. I can't drive. It's tough to type. It's really hard. It's not every day, but it's always that day you have to get something done. And I struggle with that. One thing you wouldn't even imagine would be a problem in the kitchen. The worst thing to ever happen for people with arthritis in particular and lupus, those pop top cans, they are not user friendly. I can't tell you how many letters I've written to the Arthritic Foundation, the manufacturers. All I can say is, finally, there is a can opener out there, in case you didn't know. It will cut those pop tops. Instead of cutting from the top, it cuts the side. So now it's safer for you. Because you have to pull that top out when it cuts from the top. You can cut your finger. You don't have to do that anymore. I love my new can opener. I no longer have to cry when I can't open a can of corn. You can't imagine when you really want corn and you can't get that can open. I have cried over cans of corn. And in the kitchen, sometimes depending on the strength of my wrist, I can't move the pots. So I'm forced to eat out, which is not that big of a problem because I never was a fan of cooking in the first place. But sometimes you just really want that rice and gravy. But when you can't move that pot. So when I'm feeling good, I try to cook 2, maybe 3 meals and freeze them. So I can microwave, that's not a problem. It's those pots. And then if you use the pot, you got to wash the pot. So it's a never-ending ordeal in the kitchen. Earlier it was mentioned in my bio that I dance. And that was something that was amazing to most people, particularly my rheumatologist. I was one of his prized patients because very few were doing the things that I was doing. I determined after I came out of that 5-year depression and I lost that weight, that this was my life, it was my body, and I had an unwelcome visitor. And I refused to let it control my life. So I tried to live as normal as I could. I took these dance lessons when my son went off to college, and in the class was a young man. He was 22 years younger than me, And we danced all over the place. We've danced in the Galleria, we've danced in Galveston. We've been all over the place doing exhibitions. Sometimes we did contests. I think we won like 3 contests. The first one we had a standing ovation. It was I mean, I just never imagined I would be dancing. Here I am with, I think I was about 20 years in at that point. 20? Well, I was well into lupus, and my knees were still hanging in there. Those dancing days are over. But I got it in when I could. And that's the thing with this lupus. If you're feeling good, you think you can, go ahead and do it. Now, one thing I've learned not to play with is the sun. Now, I can play if I want to with that sun. If I stay past 2 hours in that sun, I'm in the bed for 3 days. It has taken all of my energy. I did 8 years as a counselor at the University of Houston summer camp. 40 years I lived on campus. And we would take the kids to these water parks and stuff. You know, I want to be tanning like everybody else. Okay, go on out there. I got by the first weekend going out to spring. So when we went out there to Galveston, to Moody Gardens, I was down for the count. So I've learned 2 hours is my max in the sun. It doesn't matter what I'm wearing, 2 hours is my max in the sun. But again, I'm a homebody. I like indoors, I like AC. I like being away from elements like mosquitoes and flies. They don't live in my house long if they make their way in there. You know, outside is your home, inside is mine. Let's stay in our own space. Driving, I have a lot of people here at church that fuss at me, but I don't even tell them when I'm going out of town now, so I don't have to listen to them whine and complain about me driving by myself. I said, well, I'm not really alone. I said, I'm driving with Jesus. I think I got good company. Because I'd get in my car, drive to Dallas. I drive to New Orleans. Ain't nothing of it. I have friends in New Orleans particularly, because that's why I've been going a lot. They laugh. It takes me like 7 to 8 hours to get there because I stop up and down the highway. I know people in Bridge City, Lake Charles, Bro Bridge. I talk to these people, and I do that specifically to be in that camera. If something happens to me, they can trace me. I'm on the cameras. I'm not crazy. I read the TV. I watch the news. You know, you got to be seen. Where were they last seen? I'm by myself. And but yeah, I get in that car and I go wherever. And if I'm tired, I just don't go. Thank God for Amazon. Naps. I mean, that was something I just did not do. I mean, I can wake up, eat breakfast just to take those pills, and an hour later, I'm taking another nap. And that's something that's been going on for the last year or so. And I'm like, okay, what is that? Am I going to a new realm? I think I am. But at any rate, it's nothing for me to take a nap. And if I miss that nap, I know. I know. Let's see. One thing I did have to learn, because I am a very busy person, I'm a busybody, I had to learn to say no. I have people right now a little, because I've told them no. They're not used to that. But for my own sanity, I've had to learn to say no. I'm picking and choosing what I do now. I can't do everything for everybody. I can, but it's not good for me. I have to say no. And that's the other thing. You lose your train of thought with this. And it's written down. But I make lupus work for me. It's, you know, I was given an orchid of lemons, but I've learned to make lemonade, strawberry lemonade, raspberry lemonade, whatever lemonade you like, I've got that flavor. I've learned how to make it work. It's some things I know that I can't do. I can't stand a lot of heat, so I don't, like I said, I don't cook often, don't care nothing about cooking anyway, but I love to bake. And I have to get myself prepared for that oven heat when you take that cake out, you put that cake in. So I don't bake as often as I used to. I had a bakery. I was doing well. I was making these cakes for 500 people, traveling to Galveston. I had a lady wanted me to go to Lafayette, but I said, no, I have to bake in my own kitchen. But I was really good at it. I made a cake for the Portland Trailblazers. That was my first professional cake. I mean, you know, it was great, but because I wasn't able to, I started getting to where I couldn't handle those cakes. Those cakes get very heavy with that icing. They could be up to 25, 50 pounds. And so I said, you know, my mother raised me that if you can't do it right, you don't do it at all. And before I put out a bad product, I retired from it. Now, I'll bake a cake if I feel like it. If I want to decorate it, I will. I have one person right now, if they ask, I do it for them, as long as I'm okay. And they like for me to make them, I use a wine bottle to make a Jack Daniel cake. It looks just like the Jack Daniel honey, the whole 9 yards. Oh, I'm kind of talented that way. But back to my hobbies, I love to sew. I don't get to sew as much as I like because sometimes when your fingers and your wrists are bothered, you can't guide that fabric. So you have to kind of wait for the body to say, okay, we're ready today. Because you can mess your seams up. If you know anything about sewing, nothing worse than a crooked seam. It's just so much. I had more of this written down because sometimes I'll forget. And I will ramble, and I'm sorry, that's just part of the lupus. I don't always stay on track, so you have to keep me on track sometimes. But it's an interesting illness to have. Some days when I wake up or I'll be in the midst of doing something or can't do something that I know I can do, I laugh. I used to cry about it. I laugh and I'm like, this is just crazy. It's all of these years with lupus, but it still surprises me. There are things I just can't do. And you don't do some things all the time, so when it comes around and you can't do it, I just laugh. And it's either that or cry. And crying didn't solve it, so I may as well laugh. Because I don't want those frown lines. I'm kind of age now, because you can't get rid of those lines and wait like you used to when you're young and tender. But it's a livable illness. You can have a good life, a modified life. You have to have people in your life, as you stated. Your support team has to be there, and they have to be understanding. And if you don't have that support team, it's going to be a hard, long road. And if you know of someone, and I don't know personally, but I know of people that have relatives, they won't take any medicine. And one lady, her relative, by the time she decided she wanted medicine, her body had locked up on her. Well, they can't help you at that point. When you have these illnesses, you can't play with them. You can't be an ostrich with your head in the sand. You have to get the care you need. Yeah, I hate pills. I'm not on 30 a day, but one is bad enough. But you have to do this. I mean, even if you're doing holistic care, I know people that have done it through holistic. And that's fine, but you need to do something. Your body is not well. You've got to give it something extra. Be it pills, be it whatever they do in holistic. I don't know what holistic is all about because I've never done that. I've had people trying to get me to switch over, but one thing I do know, when I went to one job and they found out that I had lupus, everybody wants to come to me by taking all these herbs and this and that and the other. I can tell you right now, I get into great debates with my friends online. I've never been a fan of herbs, otherwise known as weed. I understand that it helps people. It's just never been something that I was interested in as a teenager, as an adult, and now. And I understand it can do some good. Just not interested. Put it in a pill, I'll swallow it. But I'm not doing anything else. It's just not something I see in my future for my care unless my doctor says it. And that's the other thing. People always want to recommend things, and I let them know. Let me verify this with my doctor. Because I do research. Because as a lupus advocate, I'm privileged to things that a lot of other people aren't on a daily basis. For example, when it's time for the shots, for the vaccines, oh no, I wasn't taking the shots. No, I don't believe in needles. I've never had a flu shot. And I'll tell you, in February of 1996, I caught what I thought was a bad cold, turned into flu. I was almost hospitalized. That thing nearly killed me. The doctor told me, well, I need to put you in the hospital for 3 days. I said, for what? He said, well, you need rest. I can rest in my bed. It's free. I said, trust me. So my dad was still living. So my dad was my nursemaid. I don't know which one was the worst. Dealing with the bronchitis and asthma and the flu and pneumonia, all that I had going on, or his cooking, because my daddy wasn't a cook in the house. It's just a rough. When you don't have taste buds and you still taste the bad food, it's pretty rough. But he tried. And so after my 3 days, I went back and I was better. And then I was able, because I had to leave work. And that was pretty rough. But I made a vow to myself, and to this day, I don't think this is wood, but it's a have to serve. I have not had a cold since February '96. When people start sneezing, I don't care how cute a baby is, let it sneeze once. I stay away from people. I avoid them. And being Catholic, the greatest thing that ever happened was to stop doing that handshake. Oh, not touching these hands all the time. Oh, this is my favorite thing. Think I'm losing my hair. It happens. Look, let me tell you about these wigs. So I buy a lot of different wigs. And we had a wig drive when my son was at Worthing. I had a junior achievement group. So we needed to do community service. And so I told my coworkers, like, girl, I'm so tired. What do I do with all these wigs? I buy all these wigs, I get tired. They said, well, you can give them to MD Anderson. I said, what they gonna do with them? So they were refurbishing them before the pandemic. They're not doing it now. But we brought them about 10 black bags of wigs. Those kids were hustling. One little boy was taking his grandmother's wigs. They didn't know they made wigs in gray back then. And somebody won't admit to, but we had a toupee for a man. Those kids were hustling, baby. And so MD Anderson finally said, we got enough right now. That's before the pandemic. And but no, we were. I mean, but I wear the wigs. Not we get into these debates on Facebook about these men that don't want women in wigs. But if you wear your natural hair, you won't look at us. So what you want? Make up your mind. You know, you want it here, you want it there. I marry 24/7. Some days I wear the wig, some days I don't. It just depends. Sometimes I wear wigs according to the color of the outfit, because my wigs come in different colors like my clothes. My shoes and my everything coordinates. I got that from Morris Day. No, it wasn't Morris Day, it was Ludacris. It was Ludacris. Everything in that song got to coordinate. That was Ludacris. Yeah, I know a little something about rap. I had to, working with teenagers. But clothes. I have 3 sets of clothes at my house. Most women have a lot. Mine come with a purpose. There are days that I can't zip, I can't button. So I have pullovers. The days I can do buttons, then I'll wear something with buttons. Or I'll wear something with zippers. So it just depends on what day we having as to what we wear. So I have to buy a lot of clothes just for medical reasons. It's medical. I call it medical. That's why I have a lot of clothes. It's medical. Not because I'm just a woman, it's medical. That's what I'm telling myself. That's my story. I'm sticking to it. But there are so many aspects. And I was working on a PowerPoint. I had more stuff that I wanted to share with you, but I'm having one of those moments where the brain just is there, but it doesn't really want to be there. But I try to let people know that all is not lost just because you are diagnosed with lupus and whatever comes with it. For me, it was rheumatoid arthritis. Since that time, I've acquired gout. That was an interesting day when I got that gout. I've never had pain like that. So I'm like, what kind of pain is this today? Because it came in my feet. I couldn't stand on my feet. I mean, it was like walking on nails. It was horrible. And then when she's mentioned about, get the medicine to prolong, you're not going to eliminate, but you can prolong things. Because I was diagnosed with osteopenia, and I was taking this really expensive pill at the time I had insurance. The insurance wasn't going to cover. And I told the doctor to prescribe it anyway. I'll get it because I need it. And so I was buying the pill on my own. And then when I became ill for the first time in my life, I had to be rushed to the hospital. We have in Houston this Saharan sand that pops up periodically, and it'll get into the respiratory, into your system. I mean, I couldn't breathe. I was coughing. My appetite went away. I couldn't eat. I was surviving on water and Ensure. I lost a lot of weight. It's not the greatest diet in the world, but it's the only thing I could eat. Every time I tried to eat food, I would bring it back up. And so I'm like, okay, something's not right. I thought maybe it's just a bug. It's going to pass. It just got progressively worse. I got to the point where one night I woke up and I thought, oh my God, why I thought I was dreaming that I was in jail because I saw these silver bars. And when I realized what I was looking at, I was on the floor. It was my towel holder in the bathroom. I'm like, why am I on the floor? Didn't realize I had passed out for the first time. So later, the sun was up. I woke up. I'm laying next to the bathtub. I'm like, what is going on? Why am I on the floor again in the bathroom? Don't know how I got there. I hope I didn't hit my head on the tub. I didn't feel a knot, so I was okay. But I had to crawl back to the bed. So I called my son's grandmother, and she came over, because she came over the day before, and I gave her my key in case I would be just too tired. She could come on in. And so she was knocking on the door, and I said, well, just come on in. And I guess I was taking too long to make it to the front. And so she was coming in, but I finally made it up to the front, and I just passed out again in her arms. And I'm like, I don't understand this. I was so weak. I was like a limp noodle. And I'm like, I don't understand, because they've been trying to get me to go to the ER. I had never been to the ER before. They wanted to call an ambulance. I said, no, I don't want to pay the ambulance fee. I'll be okay. This is just a bad episode. I really thought it was just a bad episode, because normally I could sleep these things off. This wasn't going away. It was getting progressively worse. I get to the ER. I'm in this little wheelchair. I mean, I'm steady sliding out of it because I can't hold myself up. In 30 minutes from the time I got into the ER, they had me on a bed because I was in bad shape. They had my potassium was depleted, my magnesium was gone, my blood pressure was so low they couldn't even read it. I was in bad shape, guys. I tried to get a hold of my pastor because I thought I needed last rites. I'm serious. So I called another one because I didn't think I was going to come home. I was afraid to leave home because my mother left, went to the hospital, she didn't come back. My daddy left, he didn't come back. And I didn't want to not come back. So if I don't go, I don't have to worry about not coming back. You know, you rationalize these things. And but it was a really, really tough time for me. I stayed in that hospital for 3 days before I was able to get back to normal and everything. And it happened to me, I could feel it happening 6 months later, so I just went to the ER and everything, and they gave me some stuff and got me together, and I haven't been back since. But it was pretty scary. I have friends that would envy me because they live in the hospital. And I used to, you know, when we would fly and go to DC and stuff, all the advocates would get together for the LRA. You know, I listened to them, and I told one of the directors, I say, sometimes I don't even know if I should really be here. She said, why you say that? I said, because, you know, this one, she said, you know, I said, this one's always doing this, and this was in the hospital. She said, listen, don't compare yourself, because what you go through is just as bad. That's why you're here. And I mean, I love the LRA. These people, they're like family to me. I've been with them for 17 years. I have been privileged to meet with the FDA. 2018, 2019, I lose track of the years. But from that conversation with the FDA, we had them, they would approve 3 drugs, 2 for lupus nephritis and 1 for SLE. Don't ask me the names, I'm not even sure what pharmaceutical has the pills. But that was an honor and a privilege to me. The FDA director that recently retired, I met him. Should have took that picture like everybody else. But I've met the directors of the NIH, because when we advocate for the LRA, we also advocate for the NIH. Met them. She mentioned about the CDMRP, well, that's the Congressional Directed Medical Research Program. That's probably one of the greatest honors that I've ever had. And the way I earned the title of Dr. Science is that I stunned them. I read all of the documents that I was given, and I had all these acronyms. I mean, the first time I looked at one, I was like, what is it? It looked like Greek. I didn't know what I got myself into. I studied those acronyms, I looked up what they meant, and then I went back and reread to see how what I know is supposed to do, how does that apply to this sentence? And once I did that, I was able to talk on the level with these doctors. I spoke their language. So we had 13 proposals. After the 4th one, our chair said, wait a minute, is this your first year? I said, yeah. He said, you seem to be so versed in this. I said, well, I'm vested, I have lupus. He said, well, we've never had anybody to, you know, to speak on the way you do. I said, well, how would you know that I understand and can make a decision? That's why I'm here as an expert witness, to tell you what it's like living with it, whether this proposal is going to work. I can't tell you what was in it because I had to sign NDAs, but I can tell you this. The future for lupus patients looks really good, guys. There's some good stuff on the burner. That's all I can tell you. I mean, 2 of those things, they were so good. I couldn't even finish reading. I had to wait until I was crying. They touched me. They are so good. I had 2 of them. And I know those because even the doctors were impressed with those particular programs. So we'll find out between now and May, because we have to wait for the people in the DOD to take and sign off on them and look at all the different notes that through the journey that we put on them, signed and took. And I would be stunned if those 2 don't go through and 2 on the bubble. It's some good stuff out there. There are some people looking out for us with lupus. I can tell you that much. There are some great minds thinking. They have some really good ideas, and I hope that they get the funding. I really do. I pray for these people to get the funding, because the good that it's going to do for us is going to be tremendous. It's going to be a game changer for us. Our quality of life is going to go up, guys. Have hope. It might be gloomy right now, but help is on the way. You're welcome, dear.
I was going to invite everybody to take a break. If you need to use the restroom, grab some tea or some more food. I'm going to fiddle with the PowerPoint for a minute. Please feel free to get up, come back at your leisure. We'll give a couple minutes break here and then we'll get started. Rheumatology office here in the Houston area. This is an older, skinnier picture of me, but that's me. I'm a native Texan. I grew up in South Texas. Came to Houston about 10 to 12 years ago, and I've been in rheumatology for 10 years. I have a passion for patient education and also for helping patients every day. I call it in the trenches in clinic, working with patients to battle this disease. We talked to Mary, thank you. So this presentation was actually put together by a colleague of mine, a nurse practitioner working in New York City. So thanks to her for that. I have to give a little bit of a disclaimer here. All the content here was developed by Rheumatology APP and the Lupus Research Alliance and Lupus Therapeutics. So the material that's presented here is for educational purposes only, and obviously should not take the place of advice and guidance from your medical providers. The comments here, some of my anecdotal experiences are not necessarily reflective of the views of these organizations, and they do maintain control of their educational materials. And then thanks again for our support in this initiative by GlaxoSmithKline and GSK. So, what is lupus? I think all of you could probably give this slide presentation better than I can, but what it is not contagious, it is not a cancer. It is a complex autoimmune disorder affecting almost every organ system for many people. And what I hear from patients in the office oftentimes is that it's almost like the whack-a-mole game. You know what I'm talking about? The game where symptoms come and go, and you're bopping one thing down, and then there comes your skin symptoms, your joint symptoms, your cardiovascular symptoms. At times, it can be waxing and waning. And for most people who would look at you, they can't see everything that you're experiencing on the inside. Lupus can be life-threatening if it's not treated appropriately. And I think for most of our patients, there is great hope with the treatments that are now available to get to a state of remission, but that is not the reality for many of our lupus patients. So there's lots of different types of lupus, and what I experience with patients every day in clinic, most of our patients have systemic lupus, and that can involve multiple organ systems. Some patients have a cutaneous or just skin-deep form of lupus that does not involve other organ systems. There are some of our medications that we use in the medical field that can induce what we call drug-induced lupus, and this goes away, usually, when we remove the offending drug from their regimen. Neonatal lupus affects babies born to mothers with certain antibodies, and there are different types of overlapping syndromes. I think we heard from Mary and maybe several other folks that may have rheumatoid arthritis and lupus at the same time, and that is the cards that they're dealt in terms of an autoimmune disease journey. A lot of our patients may have undifferentiated disease, meaning they may have some abnormal antibodies, but they don't necessarily meet full criteria for lupus diagnosis, and we watch those people closely, and eventually they may evolve to a full diagnosis of lupus. Antiphospholipid syndrome, is something that we screen all of our patients for in rheumatology clinic. If it's something you haven't discussed with your healthcare provider, I would suggest you write it down, bring it up. About 1/3 of patients with lupus will have these antibodies that are positive, and they are strongly associated with increased risk for clotting events. So very, very important that your providers are screening you for the process there. I like to think of lupus as the perfect storm, and I know everybody here can relate to this. You've got genetic factors that what may predispose you to development of lupus. I borrowed some statistics from the Lupus Foundation. Okay, I see her back there in the back. You know, on average, I think 20% of patients with lupus have a first-degree family relative who also has lupus. And if anybody's okay with it, who here has a family member who has lupus? Yeah. Sex hormones have been, theorized to play a part in the development of the storm. And then our environmental factors, different risk factors, things like smoking, the environment we're in, stressors and things like that. Before we get into all the cardiovascular manifestations, what's not in the PowerPoint, what I think is important, is that a lot of our patients experience visually some of the skin manifestations, joint manifestations that are problematic in their day-to-day life, but a lot of organ manifestations we're not going to necessarily, as providers or as other people who are not experiencing your journey, they may not see what's going on internally. So I have a lot of patients that describe to me feelings that they've been having for years or even months, where they've been to 2, 3, 4 other medical offices and nobody has been able to diagnose or pinpoint that the root of their issue is actually lupus. How many people here with lupus today had been seen by medical providers for more than 5 years before being diagnosed with lupus? More than 10 years before being diagnosed with lupus. Yeah, on average, again, Lupus Foundation statistic, I think it's 6 years or more. I think that's an underestimate. A lot of the patients I see in day-to-day clinic life have been bopping around, being seen by multiple providers. They're doing exactly what they're supposed to be doing, which is going to their medical office for help, and yet they don't find their way to rheumatology office where they're diagnosed with lupus for 7, 8, 10. I've had one lady that was 15 years before she was diagnosed with lupus and started on an appropriate treatment recommendation. So some of the big initiatives in the world of treating lupus right now is how do we prevent and recognize some of the cardiovascular manifestations of the disease. We have pericarditis, which is inflammation of the lining of the heart, myocarditis, which is inflammation of the muscle, and then all these factors that can lead to development of high blood pressure for our lupus patients, different types of valvular heart disease, and then an accelerated process of plaque formation. What I talk to my lupus patients about in clinic is we need to get you screened early. We need to get you into the right person, the right cardiology office who has experience treating lupus patients so that we can screen you and we can try and proactively manage some of these things. I've had 2 or 3 patients come into the office with acute symptoms of pericarditis, and they're experiencing chest pain that's really atypical. Their breathing is quick. They're feeling like their heart is having palpitations. Does anyone have a personal experience with pericarditis in the room? Anybody? No? You had?
I thought I was having a heart attack one time.
Yeah, it's scary. It's terrifying.
It's so tight. I'm like,
Yep.
It was scary.
Yep. It's terrifying for patients, absolutely. Lupus nephritis is a different manifestation that we are focused on, identifying early and helping patients get appropriate treatment. This is active inflammation of your kidneys related to lupus. A third of our lupus patients at the time of diagnosis have this going on, and within the first 5 to 10 years of being diagnosed with lupus, you have about a 50-60% chance of this occurring. This disproportionately affects Hispanic and African Americans, more so than Caucasians. And in my experience with men who have lupus nephritis, their disease comes on hard and fast, and it's very aggressive. That's just my personal experience. The survival rates there are a little bit intimidating, but statistically, the numbers are what they are, but I think there's great hope in the field of lupus and lupus treatments for extending the life and survival rate of those who have lupus nephritis. When those of you who went to your rheumatologist or your primary care provider, they may have checked your urine for protein and asked you to go see a nephrologist. How many people have undergone a renal biopsy here? Anybody had a renal biopsy? Would you share, a couple sentences about your experience? Was it 1 day? Was it 2 days? Were you in the hospital, or was it an in and out procedure?
It was an in and out procedure. I've had two so far, but it's usually takes about 4 hours and then like 6 hour recovery, then you go home.
Yep, yep. So the reason why we identify where I feel like I explain to my patients, I am obsessively going to check your urine for protein. I am obsessively going to check your blood counts, your kidney function, your liver function, all of the lupus activity markers, because it's my job to catch this if it is happening to you, because most of our patients with lupus nephritis don't feel it. You can't feel lupus attacking your kidneys. You may have a little swelling in your legs, but who doesn't? You know what I mean? And you know, your urine may look a little different at times, but we're going to catch this if we are monitoring things appropriately. And as soon as I see protein in the urine or a patient having symptoms, I work closely with nephrologists, get them in quickly for a renal biopsy, because you know, the issue is the tissue, as we say in the medical field. Looking under the microscope, we can identify the 6 types of nephritis, and that actually will directly guide our treatment. So the renal biopsy and getting evaluated to get to that point is actually really essential in helping to guide the right treatment. So in our arsenal, which I think is a long and intimidating list, we come a long way since the 1890s when they first used quinine, actually, to treat lupus. In the 1950s, we had prednisone, basically, hydroxychloroquine, or vitamin P, as I call that, in the office, and then disease-modifying medications. Azithromycin, some of you may have taken, methotrexate, mycophenolate, and then in the past 10 to 12 years, this has been a revolutionary time in the treatment arsenal for lupus, with the development of belimumab, or name brand Benlysta, in 2011, the use of rituximab, even though it's technically off-label, medications in 2021 like voclosporin, which is loop kinase, name brand, and also anifrolumab, which is Safnello. So we use these on a daily basis for patients with lupus, but I want to focus briefly on some of the greatest advancements in the last 10 to 12 years. These are super exciting drugs. These are, for the most part, biologic medications that have revolutionized and improved quality of life for lupus patients. How many patients here have experience with belimumab or Benlysta? Belimumab or Benlysta is the name brand. 1, 2, okay. What year did you start with belimumab?
Benlysta, April of last year.
April. And it's been life-changing for you. Yeah. How about you? When did you start?
In May of 2021.
Okay. It's been life-changing, pretty positive. Good. So belimumab was first approved for lupus in adults in 2011, and I believe, if I'm not mistaken, it was first approved for pediatric patients, children over the age of 5, in 2019. For lupus nephritis in adults, it was approved in 2020, and in 2022 it was approved for kids over 5 with lupus nephritis. Anifrolumab, also known as Safnello by name brand, was approved for patients with lupus, adults with lupus, in 2021, and so was voclosporin, specifically for lupus nephritis, in 2021. Anybody here, just out of curiosity, on Safnello or anifrolumab right now? How are you feeling? Good? Anybody on loop kinase or voclosporin for lupus nephritis? So one of the things that I have conversations with about, medications every day in clinic with patients, and the question I get is, gosh, dang it, can we just do one medication? Can we just treat this with one thing? And I tell them, you know what? I luck out with a lot of patients where all you have to take is hydroxychloroquine, we can get you off of steroids, and you may be fine for a while. But by and large, the reality for most of my patients and their experience is that depending on which organ system is being attacked by lupus, medication needs may be multiple and they may change over time, which is complicated and frustrating for patients. So in terms of treating lupus, our main goal is creating disease stability, or what I like to call the goal of remission for everybody. We want to treat the lupus activity by suppressing the immune system so it stops attacking organ systems itself. We have to deal with trying to reduce the effect or the burden of disease. So I think Joanne and Mary spoke earlier. You cannot necessarily prevent activity from lupus affecting different organs, but we can slow the process, we can minimize the damage, and early treatment is key. And then also, of course, managing side effects and secondary complications from lupus. The shared decision-making model, I love the presentation from Joanne. This is actually not the model of decision-making that I learned 12 years ago in PA school. And actually my rheumatology patients in clinic have taught me a huge amount about this. This is the process where we are equal partners in your treatment decisions, and it can be challenging to weigh risks and benefits of different medication options, but it really needs to be a shared decision-making process. When I talk to patients now, I lay out all their clinical options, and we talk about what may be the first, second, or third best clinical option, but lifestyle is a huge factor. Patient personal priorities is a huge factor. If I prescribe a medication that you cannot take because of whatever reason, it does you no good for me to write you that medicine. So I have an open discussion, and patients are really actively involved in that process. And one of the things I talk a lot about is women of childbearing age and their desire for pregnancy. That comes up every time I see those patients. This is actually something I did not do very well when I first started working in rheumatology, and I credit my lupus patients with helping me to understand. I got to choose between paying for my medication or paying for things for my kids' school, or paying for this or that or the other. I cannot come to the office every month for an infusion because I work shift work and I don't have a car. So there are these things that I didn't even think about as a medical provider that requires that open line of communication so that we can share in decision making, because maybe there's other options we can use that are not going to affect your lifestyle, and that you'll be able to stay on a good treatment medication regimen. So I have a lot of questions from patients every day. What is off limits? What can I not do? And I have my own personal perspective on herbal supplements and things, but in general, the recommendation is don't take random stuff, especially stuff not made in the United States, without talking to your healthcare provider. I tell patients, send me an email, send me a portal message, call the office. I'll tell them, hey, I've never heard of that supplement that you found online. Let me look it up and I'll check it out for you. But a lot of the time, my recommendation is don't fall for the fast cure, the easy over-the-counter supplement that's supposed to cure your disease, because most of the time, it ain't happening. Anybody have any experience with talking to providers with the questions about supplements? How has that gone for you personally? Has it ever been brought up? Yes, ma'am.
It wasn't for me, but for my sister, who would not talk. She went the herbal method, and by the time she did finally go to the non-herbal, her heart was already attacked.
Yeah.
And she had
Yeah.
already damaged beyond control.
I think that's an excellent example. I've had patients that didn't realize supplements were going to have an interaction with their treatment medication, have major organ problems because of an interaction. I think that it's important to talk about what supplements you're taking. Yes, ma'am.
Just after I was diagnosed, I was researching, and I was just a believer in echinacea.
Echinacea? Okay.
Yes, and during the winter months.
Yep.
And that was one of the supplements that said, no echinacea.
I remind everybody who asks me about supplements, I'm willing to investigate anything and give you my feedback on it as a provider, but the supplement world is not at all regulated by the FDA. There ain't nobody checking what's actually going in those supplements over the counter. Just, something to keep in mind. So a lot of times my patients with lupus, it's fatiguing. And I don't have personal experience with the disease, but I have daily experience with patients. I have cried with them, I have prayed with them, I have talked to them about their experience with this disease. And a lot of the time I have patients come in and just say, I'm tired of this. I want to stop this. I just want to take a break from my medication. And I usually try and work with patients. What can we do to make your treatment regimen something that you want to adhere to, where you're feeling well, you're not having side effects from medication? Can we change you from pills of methotrexate, which make you tired and nauseous, to injections that bypass the stomach altogether and get absorbed subcutaneously? Maybe that'll help. Can we, make you a regimen of medication where you just take 1 pill a day rather than taking 4 pills of mycophenolate every day? Something as simple as switching from IV belimumab to sub-Q home injectable belimumab, if that's an option for you. It makes a huge difference just to talk about finding a workable regimen for patients and what matters for their life. Yes, ma'am.
I now take the injection.
Of belimumab?
Another one that she has me on instead of that.
Methotrexate?
Actemra.
Oh, Actemra for a different process.
Right.
Okay.
But they showed me, because at first when you say injection, people think needles.
I'm on the mic. Oh, I'll speak up.
Okay.
So
I'm gonna bring it to her. So that they-
Oh, we have a single mic here. Oh, there you go. Thank you. Oh,
I can talk loud if you don't mind.
okay.
The point is they showed me, when you say injections, people think the needles you go get.
Yeah.
It's not, it's just like that.
Yep.
You have to
Yep.
stamp it and you hold it down.
Yep.
And it's not as bad as it sounds when you say
It is very intimidating a lot of the times when you say, we're going to start injections, you're going to give them to yourself. So in my personal practice, I can't speak for anybody else, but I will actually have patients come into the clinic with their medication, or we'll use a sample, and I will say, here's this needle. It is smaller than a hair, okay? You're going to give it in the fatty tissue, and I will demonstrate on myself, not injecting, but showing them, and then have them do the first shot in the office. And a lot of times, what's going on in terms of preparing mentally for giving that shot, a lot of that fear and anxiety, once you start it in the office, and patients understand that it's pretty easy for them to do it at home, that anxiety is way down. So, anybody else? Yes.
I take the Benelista self-injector, like she said, you don't even see the needle. I don't even know what the needle look like. All you do is press it down. I usually count to 20.
Down to 10.
Yep.
I count to 20. I think I'm lying. So
That's okay.
I do my thighs, because I just stick it in there, count to 20, and you hit a little click and put the little top. I have no idea what the needle looks like. This is life changing. That other one, whatever,
Methotrexate.
that was horrible for me. But the Benelista is 1 injection a week.
Yes, give me an injection.
Once a week, I take it on Sundays. It does make me a little tired after, so I don't play anything after. Just a day I need to rest anyway. So, I'm not trying to tell you to go get it. I just know what worked for me after all these years of being in the bed every Saturday and Sunday, because I had to function Monday through Friday.
Life changing. Yep.
It's life changing. Talk to your doctor.
And
Read about it.
I will say, for most people that experience trying the home injections, whatever medication, if something goes wrong, you have usually a nurse advocate or a liaison from the company that makes the medication who's reaching out to you. You have folks like Joanne, who are a great resource, and obviously your provider's office. Sometimes patients will call and say, my husband misfired my shot and everything went everywhere. Can I get another one? And we'll supply them with an extra sample. So easy to work around some of the injection issues. So when we're talking about treating lupus, one of the downsides and things I always talk with patients about is the side effects that unfortunately we're causing with some of these medications. That goes from infertility to hair loss, skin color changes, even things like anemia or blood count decreases. One of the things I have a passion for helping patients with is getting off of steroids. Blech. Who's been on 30 or more of prednisone a day? And you feel like, your joints feel well. Lupus activity is managed or masked by prednisone, but we got weight gain, we got difficulty controlling diabetes, high blood pressure, you get that puffy face, you get irritable. Oh, my patients who are on high dose prednisone, who we work with to help them start maintenance medication and taper off prednisone, they just feel so much better. That's one of my passions, is helping people avoid side effects from the prednisone. So before we go into the additional supplement information, I want to know from people on their lupus journey, what have you discovered? What are one or two things you've done to live well with this disease? Mary, a couple of things.
Well, one of the things that I do is I have to get a cane because some days when my body's a little tired, I still have to get around. And my hips, because I have bone loss in my hips, some days I feel it, so I have a cane. Hated the cane at first. I love the elders at church. They will tell you up front, don't worry about how it looks, you have to get around.
Yep.
So I use a cane. And I have my son's grandmother gave me a walker because when I get really, really weak, I need to have something on both hands to get around. So those are two of the things that I do. And the rest is, I try to monitor the things that I eat. I've all but eliminated fried food. Sometimes when I just have to have it, I have to have it. But I get it because it's not an everyday or a week. It's like a once a month thing. It's like a treat. But I try to eliminate fried foods. And I'm really investigating the vegan world. I'm not there yet, but that's my next frontier, to try to be vegan. At least, eliminate meat. I've gotten it to where once a month I'll eat beef. I used to love burgers, and I can't tell you the last time I had a burger. But I had a steak the other day, that's good. But I'm trying to eliminate the things that they say are not good for us, because I'm not a cold turkey person for everything. But in realizing that my grandmother and great-grandmother lived to over 100, I'm trying to get to 90 or more.
Yeah.
And I have to change my diet because my grandmother, she had diabetes and she died of natural causes. She was very strict about what she ate. She didn't deviate. She was highly disciplined. And I'm trying to channel that discipline. It's tough, but I'm working on it.
Awesome. So, yes, ma'am.
I just want to say I do not have lupus, but I just wanted to ask you guys to give a little grace. There was a funeral, so they're in the repast, so we apologize for the volume, and I've asked them to try to, keep it down, but they are grieving, so please understand and let's offer them some grace, okay? Just so you guys are aware.
And if you can't hear me, just, because I'm a little soft-spoken sometimes. Supplement, yes, ma'am.
So, I don't have lupus. I do not have, I have plenty of other issues. Some of them can be helped, some not. But with what we do with our lupus warriors, we support around 5,000 lupus warriors directly. One of the things that we hear over and over is they don't wallow. So we have a pity party, like give yourself 30 minutes, a good cry, get it out, then go have some ice cream, preferably with friends or a puppy, and feel better, because the quicker we get back on course to managing the disease, the quicker we can maintain a thriving life. Even though there are days we want to stay in bed and curl up and watch a bad movie, right? Give yourself that moment to grieve, and then get up and do what we women do. Get after it and get things better.
In terms of supplements, oh yes, ma'am. Okay, in terms of supplements that I do tend to recommend, or that are generally recommended, calcium and vitamin D supplementation, especially vitamin D3, go hand in hand with treating lupus for me and encouraging all of our patients to do that. Optional things that are probably not harmful would be omega-3 fatty acid, B vitamins, turmeric as a supplement or as a dietary addition. I'm not sure what MTV stands for here, but I do tell our patients with lupus, you want to have an alert in case you are incapacitated and you need to have someone help you get to medical care. If you've been to the ER, urgent care, sometimes they don't know heads or tails always what to do about lupus. So wearing an alert bracelet that says I have lupus, I'm on Coumadin, can be life-saving. Yes, ma'am.
When it got to the point where I had giant cells.
Arteritis? Yes.
Yes, and I could have had a major stroke at any point. My family put me on, they tracked me
Oh,
on my
yeah.
phone. So if I'm not back at a certain time, they'll look to see where I'm at. Because at one point, you may not be able to respond. You may not be able to pick up. For example, yesterday I went shopping and I got home and my husband said, "What you doing at Academy?" And I said, "How do you know where I'm at?" And it reminds
Go
me that
back.
all of the family members, not just him.
Yeah.
I'm tracked. So even if I go anywhere traveling, they know where I'm at. What type of device? It's a Google
tracking.
You got a
It's an
cell
app.
phone.
It's an app for the phone, I think.
They'll put,
Yep.
You can actually add people that you want to track you. Okay?
Yeah.
And so even my daughter in California knows where I'm at.
Wow.
Okay, so you got 4 people, so if 3 doesn't respond, you got that. That's just close people. But you can, you have to get a tech person. Like my son is a tech person, and he put it online. But most kids know how to do it.
Yeah.
You have a major episode and you can't get help, they know where to come find you.
I have a lot of
You gotta have your phone with you.
That's true. I have a lot of patients ask me about what can I do with my diet to help myself. And this is a big area that I think is constantly evolving in healthcare. I will say, honestly, from a medical training standpoint, nutrition and dietary aspects of treating disease was not well touched on during most typical medical educations. I've learned a lot about things that promote inflammation and help our lupus patients with symptom management. I will say, always a discussion to have with your healthcare provider. It does not necessarily take the place of treatment medications to manage your disease, but you can help yourself by making dietary changes that help with symptom management. So I'm not a person who would ever tell a patient to try a diet change that I was not willing to try myself. So I did this gluten-free, meat-free, dairy-free, and it was no joke. Like, if I'm being honest, I couldn't do it. I could not do this 100% of the time and live life. But if you are able to make some of these changes, avoiding gluten, avoiding processed sugar foods, avoiding red meat and certain dairy products, and eating a lean, vegetarian heavy diet with lean protein sources, you're gonna notice a difference. I mean, I think we'd all feel better, you know what I mean? So anybody tried this type of autoimmune diet change? How are you feeling?
I feel great. I'm careful to say that. I don't want to say it in a doctor's office. My name is Kat. I was diagnosed with lupus in 2018, and I would cry once a month because I didn't know. So I have friends and supporters. And so I did, like, in 2019, I went to Dubai. Well, when I was diagnosed in 2018, I was going on vacation. I love vacation. And I cried before I got on the plane because I could not wear pretty bikinis like all other people. So I learned how to make those life-changing alterations. Now, I put my bikini underneath my full body swimsuit.
There you go.
So in 2019, I went to Dubai and I read a book, Goodbye Lupus. Even though I still have lupus, and it was talking about eating more kale and eating more spinach. I had that book a year prior before I even read it, but because the flight was so long to Dubai, I had nothing but time.
You had time to do it.
So I changed and started making kale smoothies. Now I do not cook, but I will make a good smoothie.
There you go.
With the fruits and vegetables, and I go back and forth between eating meat, not eating meat. But I can definitely tell when I do eat meat, my body, I cannot walk. I get up and I'm like handicapped, so they think I'm playing. They're like, "Why you acting like that? Don't you make it fun of people?" I'm like, my muscles are weak. I just not. But when I'm sticking straight to just fruits and vegetables only, eating a lot of kale and vegetables, then my body feel a whole lot much better. I mean, a whole lot better, and I don't have the inflammation.
Yep.
Because my
Yep.
joints, I look nice on the outside, but my body is horrible
Internally.
on the inside. And thank you, Joanne, when you girls that are dancers, been dancers and cheerleaders for 15 years. And there be times that I just cannot move, and I have to call somebody else. Like, I cannot get out of bed. And so I will push myself because I'm also a Houston police officer and I'm a U.S. Marshal. And so there'll be times that I know I need to go and do stuff. And I cannot save anybody because I can't save myself
Yep.
right now.
Yep.
So I just have to, and I was embarrassed at first to share anything that I was diagnosed with lupus, but I have come to be more open about it and share my feelings. So thank you for that
Yep.
information.
Yep.
I was just asked about my medication regimen, and because my rheumatologist left and moved out of town, I don't have one.
Hello.
So I need to get somebody else, like Hester, about her, or
Yeah.
somebody.
Yeah.
But
We can plug you in. We got all kinds of information. Absolutely.
I know I'm long-winded, sorry. So I do have two questions. How often should I get my kidney checked? And I'm getting like chemical stores a lot of times in my mouth.
Yeah.
And it's uncomfortable, like even now, so please excuse my fault.
No worries. Very good question. I think kind of in general consideration, usually every 3 to 4 months, we are monitoring closely kidney function, disease activity markers, and proteinuria, screening for that in the urine. So I would say after you're initially diagnosed, you might want to check it more often and work with your rheumatology office. But in general, for most of my patients that are on a treatment regimen, it's every 3 months for monitoring that. Yeah. Yes, ma'am. Yes.
Well, I'm starting to learn something. How many people here with Dr. Paper? Raise your hand.
Dr. Pegram? Yes.
How many patients were with Dr. Paper before you got Samuel Paper?
What?
What was your question? Samuel Paper patient. Yes, that was me. All of us, we're all lost in the wilderness right now.
Yes.
We found a rheumatologist because he's a hard act to follow. Yes, he is.
Yep. Yep.
And we're lost.
Unfortunately, I understand that. It was a huge loss to the Houston community of rheumatology after Pegram left practice. But if you need help with resources, I got resources. Lupus Foundation has resources. We can get you plugged into rheumatology care and expedite the process. Yeah, we don't want you hanging out there without the help that you need, for sure.
We have vetted doctors.
Yeah, yeah.
We have vetted doctors that we work with that know and understand lupus.
Yep.
We don't just send you to anybody.
No. And I'm going to personally plug my office. I work with 4 rheumatologists, Dr. Prashant Sankareddy, Dr. Hema Salvati, Dr. Aurora, and Dr. Danny Tekamural. And then there are 2 PAs in our practice, and we are in Pearland in Texas, in League City, and about to be in Pasadena. So we have access for you. Yes, ma'am.
Are you familiar with rheumatology in Houston with Dr.
Dr. Vo I'm familiar with. I've never worked with her, but I do know of her practice and a couple of her locations. I'm pretty familiar, yes. But happy to answer questions about helping you. And I know we have all kinds of resources here locally in the community to get you all plugged in. Exercise. So we touched on this, and I think we've got just a couple more slides. I'm sorry about some of the length of this, but exercise is so important. If you can find a type of exercise that works for you, Lupus Foundation has yoga classes, is what I understand. I've never been to one, but they're fantastic, is what I hear.
Harris County has free lap swimming and free exercise in the water. Harris County, used to be El Franco Lee, but now Roger Ellis.
Yep. A lot of times I'll help patients with working with physical therapy. If they're not able to exercise, even walking, I'll help them get referred to physical therapy so they can build their strength to be able to exercise. Whatever you can do to stay in motion. Our motto in the office is a body in motion stays in motion. Exercise as much as you can. Sleep is a non-negotiable. This is what I tell patients with lupus, and what I hear from them is you gotta get restorative sleep. If you're not shooting for a goal of at least 8 hours of sleep, you are not gonna get enough rest, and that's gonna worsen the ability to manage your disease. I mean, all of us, there's gadgets, electronics, there's Facebook, there's the TV. You gotta prioritize getting enough sleep It is absolutely a non-negotiable. Stress. How many people have had a good stress, life stress, getting married, going on an awesome vacation, bad stress, where losing a family member, changing it with a job loss? How many people have had stress send them into a lupus flare? Everybody. I really, I'm gonna pick on my female patients with lupus, and I tell them, we are really good as women taking care of everybody else. We are the caretaker, we are the matriarch, all of these things. You have to take care of yourself to be able to take care of other people in your life. You have to prioritize self-care, and part of that management of the stress process is knowing, is this something that I can control? And learning how to let go of stress aspects that are not in our control. Setting priorities, getting plugged in to make friends who understand your experience, the activities and liaisons that we have available. Get plugged in to your lupus community. In Houston, we are incredibly blessed to have countless, I say 15 to 20 rheumatology offices. We have Lupus Foundation, Texas Gulf Coast chapter. We have the Research Alliance. You have so many opportunities to get involved and get active and meet people and interact with people that are going through exactly what you're going through. One thing here that's not on this slide, but Mary touched on it, and I know Joanne did as well, mental health care for patients with lupus. This is something that I had to learn as a provider from my patients. And I take time at every visit, and once we've talked about how their lupus activity is doing, I say, how's your mental health doing? How are you managing? How are you coping with stress? Because most of my patients with lupus at some point in time have had really, really low points in managing their disease, and there's periods of darkness and time there. And offering people hope, reaching out with a call. If my lupus patients miss their appointment, they're getting a call from me. How are you doing? What happened? How are you feeling? Can I get you in? Can we do a telemedicine visit? Because I know sometimes they physically cannot get out of bed, and sometimes they're feeling really down and depressed, and they're just having a rough time. So something that you never want to feel ashamed to ask for help. Always want to know that you have resources available, and don't neglect mental health. It's a huge part of your journey with lupus. One thing I'll just touch on here, pregnancy conversation needs to be something you're comfortable talking with your provider about. Every woman of childbearing age who has lupus, I have this discussion on a regular basis. The best time to be pregnant with lupus is when your disease has been kind of treated into submission. When it's in near remission or it's been inactive for a year, you get all kinds of dangerous complications for mom and baby if we are conceiving during a time when lupus is active. Lots of options to plan and prevent pregnancy. Don't be afraid to talk to your medical provider about these options. They should be bringing it up. They should be talking with you. Like Joanne said, if your provider is not establishing open communication with you about important lifestyle options, fire them and find someone new. I have patients that have come in and said, "You're my third rheumatology provider to see in the past 2 months. I didn't like them, so I'm here to find out if you're for me." And that is what it is. Lots of options for patients with lupus. One thing I will say is, in general, I try to help patients find gynecologists who will help them find a non-systemic estrogen-containing pill option. That means either Implanon, IUD, Depo-Provera injection, or progestin-only containing pills. Again, the benefits of planning pregnancy and using birth control options would be to prevent flaring that happens often in pregnancy, and then making sure we're going to have a healthy pregnancy. And the best opportunity for that is when your disease is under control for at least a year. This slide, again, is really about talking with your healthcare provider and being open about lifestyle, preferences, STD screenings. Sexual health is an important aspect of all medical care. And then from a preventative health standpoint, here we have listed pap smears and mammograms, obviously very important. In our office, we are super heavily focused on preventative health. I talk to patients every day about protecting themselves from communicable diseases, vaccinations to protect them from community-acquired diseases, cardiovascular preventative health, and also what to do if you find yourself in a situation where you can't get preventative care. I'm so surprised and I'm so thankful to live in this region where we have access for patients who have never before had access easily to a primary care provider to help them get screened for cancer and heart disease and diabetes. It is unbelievable, but it is so prevalent. And then again, cancer screenings, and also just making sure you're touching base with people that need to keep your rheumatologist in the loop. I think that's important. So Joanne talked about this earlier. I think this is wrong, this 18 minutes. I think I get like 10 minutes when I go to the doctor, and I'm a medical provider and I'm over there later. What did they say? And so I think being your own advocate, knowledge is power, but bringing a family member or a friend with you to her appointment to advocate for you and to be a second pair of eyes and ears, so important. I tell patients, if your family member doesn't understand why you can't get up and do that function today, next time you come to the office, you bring them. I will tell them. We're going to educate them together about your lupus disease and your journey, because they need to be here to hear about it. Yes, ma'am.
I was on so many medications at one time, I couldn't remember them all. So when I go to the office, I bring that paper with me.
Yep.
And I have everything, the insurance, the pharmacy, the prescription, when I take it, how much I take it, where I take it, whatever.
Yep.
And I keep one in my pocket, so if something happens and I'm not anywhere around, the emergency people can look and find that information.
I think it's really important for patients to write a list of questions, write your own personal priorities and things that you have down before you get to your appointment. Don't let your provider sneak out the door until you felt heard and understood. And it may say, hey, wait a minute, I have 2 more things on my list that is my priority for today's visit. And we'll stop and we're going to take time to listen to you. And then finally, research participation. I think research opportunities for lupus patients are growing. We have a lot of opportunities. We'll share some information on how to get plugged into that at the end of the slide show. But you can participate in research trials where you may actually have more frequent access to your experts and your physicians and providers than if you were just seeing a private practice clinic. If you're enrolled in research trials, you're often receiving top-notch care on a more regular basis. And then also, with lupus, it disproportionately affects people of color. African American women, Hispanic women, Asian Americans, way more often affected by lupus. And a lot of times when we're making decisions and things based on clinical research, these populations of our most affected folks are not well represented in clinical research trials. We want that. Yes, ma'am.
One of the problems, I don't know if you can hear me now.
No, turn it on.
I guess it's doing, hello? Anyway, hopefully y'all can hear me. One of the problems with trials, I've been trying for years to get into a trial. So if I try for lupus, the RA knocks me out of lupus. So if I go for the RA, the lupus knocks me out of that. Well, what do you want? Do a trial with both.
You have to.
What you want us to do?
Yep, based on the criteria for the studies, they can be pretty exclusive sometimes. Yep.
Why even bother? You keep getting told no. Well, I'm trying.
But
I am guilt-free.
You've done everything you can to try. There's lots of options out there. If you can't participate in an actual clinical trial, you may want to be a part of an advisory board where they get your opinion as a lupus patient on how to design trials, feedback on educational materials. There are other ways besides being enrolled in a clinical trial for you to be involved in that process. And finally, working with advanced practice providers. I'm a physician assistant. Joanne's a nurse practitioner. Where are my other nurse practitioners in here? I thought there was one more. So I'm going to plug APPs. If your rheumatology office or your doctor's office has a PA or nurse practitioner, utilize them. We can be your best advocate. We can be a resource for you. We love patient education. I tell patients, I have a lot of patients I give my personal cell phone number to and say, you call me. If you're in a flare, you can't get to your appointment, whatever, if you have a problem, you need to get answers, call me. I have them emailing me. I don't care if you're emailing me 9 o'clock on Friday night. I will get back to you, maybe not right that day, but the next day. But we can be a powerhouse in your corner. Education differences exist. Nurse practitioners are trained oftentimes with a bachelor's in nursing or otherwise before they go to nurse practitioner school. In the nursing model, is my understanding, PAs and physicians are trained in the allopathic model. I know from my personal experience, I shared cadavers and shared training courses with physicians in training. At a minimum, we all have a master's degree, some have a doctoral degree, and functionally in the clinic, a lot of times we are delivering care alongside rheumatologists. I have some patients that say, you know, they enjoy the time spent. You might have 10 minutes and an 8-week wait to see your rheumatologist, but being in the clinic where I'm at, I have a schedule that's not fully booked every day. So if I have patients calling in, they're saying, I'm flaring, I can tell, I can get them in that day. Next day, I can save them a trip to the ER. I can inject or drain their swollen joint. They don't have to mess with urgent care, 6 hours in the emergency room. Come on into the clinic, your APP can make that happen. How many people have seen a PA or a nurse practitioner in their rheumatology or other doctor's offices? All right, good. So just take home messages. Lupus is one disease with many different manifestations. It's hard to treat, but we have options and things are changing for the better for our lupus patients. We have a lot of medications to deal with, lots of side effects to discuss. We need a multidisciplinary approach with shared decision making for patients who are their own advocate, but who demand being heard and treated appropriately by providers that care about listening to you and your individual journey. Mental health with lupus management is key. And then, of course, I'm biased. PAs, nurse practitioners, pharmacists, we're awesome. We're here to help you. So these are some of our websites and things. You can screenshot this. You can go online, join these social media by following folks, or go to the websites to explore clinical trial options. And any questions out there? Things that weren't touched on in some of the slides or presentations? Anybody have any questions? Yes, ma'am.
What would you recommend if, say, we're changing doctors? What can we bring to the new rheumatologist?
Okay, great question. So if I have had this happen for patients before, and what I like to recommend is if somebody's moving, I tell patients, make sure you see the person that you've been seeing and ask for a 3-month supply of your medications. Ask for copies of your visit summaries and lab reports for the past year so that you can go with your paperwork and a supply of your medication to your new rheumatology office. That helps so much. But if you can't get access to your records and your labs, don't stress. We can oftentimes just request those sent over or start from scratch and pick up where things are left off. But in the state of Texas, I know you have the right to receive care with your established provider, even if you're switching to another office, unless they tell you you have 30 days to find a new provider. So they should be able to provide 3 months of medication for you or extended medication if needed. So, good question. Anybody else with questions?
I don't have a question, but I really want to thank you for y'all coming out here.
Yeah.
I've had a couple bad pitch parties, but at least now I know it's normal.
Well.
So that's good.
Oh, no, I was regarding your records.
Yeah.
Those of us with Dr. Payton that were with him for a long time, when they had that computer crash,
Can't get them.
we lost a whole bunch of history. So once a year, get your records from your doctor.
Very good idea.
Because if their system crashed, whether you change or stay, at some point you're going to need to know your history. And you've lost a whole bunch. Because what I didn't tell you is that I'm a cancer survivor. I didn't tell you I survived iritis twice. And for those of you that don't know what iritis is, I've been totally blind twice. All those records were lost. It's just my word. When I wrote my story, I update my story as I go, and that's the only reason I know dates. And that's all I have from the beginning.
Thank you, Mary. Anybody else with questions? I would encourage you to pick our brains, get plugged into local resources. Every year we do the Lupus Walk here in Houston. We have a lot of programs coming up through the Lupus Foundation. Go on their website. And if you need a rheumatology office to help you, I brought cards of mine. I can get you plugged in and tell you who all the rheumatologists are in their offices in the city of Houston metro area. I can help you get you plugged in somewhere that you can get to for your care. So Thank you all so much for your patience and today. Yes, ma'am.
Well, I thank all of you for coming. Hello. Thank you.
Thank you.
Appreciated everything you had to say. And if I haven't talked to you, I would like to invite all of you back a month from today. We're having a Women's Day here.
Okay.
It's a fun day. We're going to feed you. We're having a French theme. We have a chef from New Orleans. We're having French desserts. We're setting up a silent auction like you're shopping in Paris. It's going to be gorgeous and beautiful. The food will be good. If you've been there before, Georgia can tell you, she was there. And we're leveling everything up this year. Okay. So it's a great afternoon with women. Yeah.
Mary, what day is that?
March 25th.
Thank you.
25th.
25th.
And
All right.
so we welcome you all to come on back.
Oh,
One last thing.
yes.
Don't forget to fill out the holiday.
Post survey. Thank you, Robin. I forgot.
You can either hand it to me or leave it at the desk.
Give us your feedback, good, bad, indifferent. We want to know how you enjoyed the program or what needs to be different.
So if I don't have your email address, make sure I get it and I can send you an email blast and get ready to send those out.
Okay.
You don't want to miss this day.
Thank you.
Thank you all so much.